You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Alabama's go-to implant dentist, Laith Matalka. Dr. Matalka, welcome to the program.
Thanks for having me, Randy.
Now, I know you brought a stack of photos, so we're going to try to get to as many of those as possible. Now, for people that don't know your practice, like who's the typical implant patient?
Yeah, I don't have a typical patient. Most of my patients fall, but if I have to put them in a category, they fall into two categories.
Okay.
The first patient are the patients that have teeth, but they have loose teeth, bleeding gums, pain chewing, have missing back teeth. And so with those patients, we can do and they've heard that they're going towards a denture, and no one wants a denture, Randy. And so for them, we can give them upper, lower, full arch of teeth the same day.
Is that right?
Yeah.
Not an exaggeration?
Not an exaggeration. Same day, 2 visits, we can do that for them.
Okay, good. Now, who's the second group?
Second group of patients are my kind of denture wearers.
All right.
They think just because they got a denture that they're done. They've got all the teeth out, they got a denture, and that's the end of the road for them. But it's not. These are the patients I can help the most.
Why do you say that?
Well, those are the people, they go to restaurants, they put adhesive on that, they put that glue on their denture to keep them in.
Okay.
And so these people I can help them eat and function the most.
Now, is this true? Because you told me this. You said, especially like a denture wearer, they can walk in the day of the procedure with no upper and lower teeth. They can walk out that same day with upper and lower teeth that don't come out.
Exactly.
Full set.
Exactly. We can do it in 2 visits.
Is that rare? Or you do a lot of that?
So this is all I do.
Okay.
All I do is dental implants and no more dentures. This is all I do. And so it's not rare for us in my practice.
Now you are, I guess you're practicing in the town you grew up.
Yeah,
is that right?
Exactly. I grew up in the Hoover community.
Right.
I know where the best places to eat in Hoover. We got Saw's Barbecue and Jim and Nick's.
Okay.
And so I grew up in the area, went to Hoover High School, went to UAB undergrad, UAB Dental School, did my residency program in Hoover. And so these are the people I can help with, and hopefully I can help my my high school friends and all the people.
Have they come in yet?
Not yet.
Because you have a fairly brand new renovated practice.
Yeah,
is that right?
Brand new practice, fully equipped with digital scanners, face scanners. We have brand new technology in my office, so we can do things much faster. It takes go into 2 different offices. We can do in my office, and we can do it instead of 6 or 7 or 8 appointments, we can do it in little as 2 or 3.
Little as 2 or 3 appointments, and they could have somebody watching this. Now, of course, you'd have to have an opening in your schedule, and I'm putting you on the spot here. But if somebody's watching this with horrible teeth and gums, bad teeth and gums, or they're currently wearing a denture, next week they could have a full arch of teeth that don't come out.
Oh yeah, now I've had.
Is that true?
Oh, 100%.
Okay.
I've had patients. We don't usually do this, but I had a patient come in on a Monday, and on a Thursday she left my office with a full set of upper lower fixed teeth. And she had
When you say fixed, that means teeth that don't come out.
Oh, that's exactly what I meant. Teeth that don't come in and out, a full arch of teeth. Attached with dental implants.
Okay, so help me understand here, because you said fixed teeth, and we talked a little bit about this. So there's a trend where they do a lot of snap-in dentures.
Yes.
And they think they're getting teeth that don't come out. Because you're not a fan of these snap-in dentures.
Yeah, I don't like them because my patients don't like them.
Okay.
They in their minds, the dentist or whoever they go to tell them these are like teeth that don't come in and out. But they're not.
You used to do those
a
lot?
I do them. I still do in my office. It's a stepping stone. Dentures are a stepping stone. These snap-in dentures are a stepping stone.
Okay.
If people can't do them right now, if they can't do the full arch of teeth right now, these are good options for them. They're better than dentures.
Now, but what if somebody, and I know this is true, if somebody's been wearing a denture 10 or 15 years, they can't do this because they don't have enough bone?
Oh, no. That's
not true?
Not true at all.
Okay.
And so these people I can help the most because they have in their minds that, they can't get dental implants, or they've heard it from another practice that what their techniques are, they can't do dental implants. In my office, they can. I can't tell you the amount of times that people the patients tell me, oh, I don't have enough bone. They come to my office and they have plenty of bone. I mean, I can place 6 implants easy. And so,
when you say 6 implants, it's like a full arch of teeth on top of those 6 implants?
Exactly.
Okay.
So generally we place 4 to 6 implants on these patients.
Okay.
Just depending on the bone. But yeah, 4 to 6 implants attached completely with no palate, nothing, attaches right to your gums. So when I say no palate, so a lot of these snap-in dentures or conventional plates or dentures, they cover your palate so you can't taste food. Some people gag, you can't function, and things get underneath them. And so with this full arch of teeth that I'm talking about, fixated with dental implants, there's no palate, so you can taste food better, smile more. You don't have anything in the back of your throat.
No restrictions as far as eating?
None whatsoever.
Like once you're healed up, I mean, you can bite into whatever.
Bite into whatever you want. Patients always tell me, man, if I could just bite into an apple. Because if you imagine biting into an apple with just a floppy denture, I mean, both of them are going to come out at the same time.
Okay.
And so yeah, just to be able to bite into an apple, eat nuts, salad, steak.
Do they have a food in particular when it's all done that they like telling you about that they eat?
Oh, I'm a fan of medium rare steak.
Okay.
And so some people are like, man, I like my steak well done. And so yeah, they can eat some really well done steak if they really wanted to.
So whatever they want, ice cubes.
Ice cubes, whatever they want.
But I mean, you don't want them to eat ice cubes. Like
No,
whatever
no.
you wouldn't eat with your regular teeth.
I mean, I don't want them chewing on nails and things like that. So whatever they want to, whatever they can eat, that's they can before.
Now in your office, you have technology where you literally print the teeth in the next room.
Exactly.
Is that right?
Exactly. Yeah, in my office. So patients come in for a consult. We get to know them, get to know exactly what they're looking for, what their goals are, what they're missing, how their life is now and what it could be. And so we talk about that. And then, yeah, we have scanners. We can scan their mouth. We take pictures and we send that.
So the days of the goopy stuff in the mouth is gone?
Gone. No more
It's like a
goopy
little
stuff.
camera that goes in the mouth?
Yeah, exactly.
Okay.
This little camera takes 3,000 photos in like 15 seconds.
Okay.
It's crazy how technology has advanced. And yeah, we can get that, we get designed, and literally within an hour we can have their teeth printed next door. And we can put the teeth in the same day after surgery. So it's really fun and exciting.
Now, and we talked a little bit in the green room, but is there more art or science to this? Because you were kind of bragging a little bit. You're a sculptor. You weren't bragging, actually. You were telling me that you sculpt and things like that. Is there a lot of art to making the teeth look real? And how involved are you in that part?
Oh, from the beginning to the end. I love, I grew up, sculpting and drawing and doing things like that, and working with my hands. I love working with my hands. That's why I got into dentistry, because I love this.
Like building things.
Oh yeah, I love building things. And so when I look at someone in my consult room, I can envision how the end product's going to be like.
You could see it.
I can see it, and I get so excited when I see these patients. I'm like, man, just let me do this, because I know what the end result's going to be. And so yeah, this is what I love to do.
So in your town, like in Hoover and stuff, I mean, you grew up there. Are you going to wipe out dentures? Is that your goal?
Oh yeah, 100%. If I can wave a magic wand, I wouldn't do a single denture. I mean, if you just think about it, it's just it's a piece of plastic. So a denture, don't get me wrong, a denture looks great. If your only goal is to have a good looking smile, and that's it, no function, no taste issues, no flopping around, you don't mind putting in glue 2 or 3, 4, 5 times a day, then denture is fine. But if you want something that has function, to be able to eat and taste food and not be afraid of that denture coming out of your mouth, then that's not what you want.
So how old can you be to do this? I mean, the upper range of patients that can do this.
No, I've done it all the way up in the people in their 90s.
90? Why would a 90-year-old want to do this?
Well,
like why did that 90-year-old that you did?
I mean, it's at age 90, eating is everything. Your life revolves around food and family and friends.
All right.
And so, why wouldn't they do it? Why would you want to spend your last 5, 10 years having difficulty to eat?
So when a 75-year-old is in your, do you ever hear this from a 70-year-old and says, "Doc, I'm too old for this"?
I mean, I hear people in their 50s, "Doc, I'm too old for this." I'm like, what do you mean? You have 30, 40 years left.
Okay.
And so, no, when I hear a 75-year-old, an 80-year-old, a 90-year-old, why should I spend this much money? Why should I do this procedure. And I'm like, this is the perfect time to do it because you can enjoy it.
Now that 90-year-old or the 90-year-olds you've helped, what do they say when it's all done?
Oh, they wish
And
they
they're
could
all
have done
healed
it
up.
sooner.
Really?
They wish they could have done it 10, 20 years ago. I mean, I've had a couple come into my office, both in their 80s, husband and wife, and they both came in like, we're ready to do this. We want to do this right now. I'm like,
Okay.
well, let's do this. And the wife goes, whoa. I want my husband to go first.
Okay.
And so I did the husband on a Thursday, and a Friday she called me on my personal number. And she was like, when can I get in to get this done? All my patients have my personal number.
Okay.
Everyone who gets care in my office gets direct access to me. And so she called me the next day and was like, he's doing wonderful, no pain.
What did you do for him?
Yeah, so both of them, the husband had a set of dentures, upper lower dentures, that
Okay.
he's had for 20, 30 years. And so I gave him upper lower brand new screwed in teeth.
That don't come out.
That don't come out the same day. And he was so thrilled and happy that he couldn't get his wife to stop talking about it. And so I got her scheduled next week on Tuesday, and we got them both done.
Okay.
And I recently called them, and they cannot be any happier. I mean, he said,
Because when you're 80, I mean, I guess you want to travel and eat the local food.
oh yeah, they want to travel, and this particular patient is, he's a pastor, and so just having confidence to be able to preach into his church. I mean, he couldn't preach in confidence because he didn't know what was going to happen to his teeth. Or I've had singers at churches. They're afraid that the teeth are going to come out while they sing or talk to their congregation, and so just being able to have that confidence that his teeth aren't going to come in and out while you're functioning and you're out in the community is so important to patients.
Yeah, but what if you have bad gums? I mean, gum disease. If you have bad gums, are the implants more likely to fall out?
No. So if you have bad gums, this is the perfect procedure for you because
Why is that?
We're taking out the bad teeth, the bad breath, all that bacteria that's around the teeth,
Okay.
and what causes infection. So we take that out, and we start with a clean, fresh plate.
Okay.
And so these are the patients I want to come in so I can treat them.
So that is the typical patient.
Yeah, that is a typical patient.
So that's gum disease.
That's gum disease.
This bacterial infection.
Yeah. So that gum disease destroys bone, and so
Is that why the teeth get loose?
yeah, the teeth get loose, they hurt, and so I want them to come in as soon as they can. The best time to do this, you always tell me, when is the best time to do this procedure? The best time to do it is now. And so the longer you wait, you could start losing bone. And it's rare that my patients don't have enough bone for this procedure, but it does happen. And I want to get these patients in as soon as I can.
Now, if you're 70s or 80s, statistically you're on 3 or 4 medications. Can you be on medications like type 2 diabetes medications and still get this done?
Oh yeah. So as we get older, we start getting on these laundry lists of medications. And these medications cause something called dry mouth, xerostomia, what we call it in dental terms. So this dry mouth causes, cavities and infection in teeth and this progression. And so we want to get those patients in because, dental implants don't get cavities. You can't get a cavity on a dental implant. And so this is the perfect treatment for those patients that are on those, laundry lists of medications. And we can do it safely in my office. Sometimes we have to talk to their medical provider, but it's a really easy. Here's a form. Let's talk to your provider and make sure everything's okay with him to get this done.
It seems painful.
No. So there's always a little soreness and some pain
Afterwards
after the procedure. But if you think about it, whenever you take out one tooth, you take out a tooth and you leave a big gaping hole there. And so that's what causes pain. So with this procedure, we take all the teeth out and we close your gums completely. Your gums are completely closed, and we attach this bridge, fixated with dental implants, so nothing's exposed to the oral cavity. So pain-wise, it's actually much less than almost any other dental procedure. And Randy, they're numbed up. So in my office, we do IV sedation, and so these patients don't remember what's going on. And when
it's like an amnesia effect?
Yeah, they have no idea what's going on, and we call it in La La Land. They're going to be in La La Land, so they're not going to know. And it's all through the IV, and so we're able to give IV antibiotics, IV pain medication, and so that gives them the best chance of not having any.
Hey, you told me sometimes, like the next day, some people don't take any medications.
Oh yeah,
Just over-the-counter stuff, like what?
ibuprofen and Tylenol. I mean, I've had.
That's typically what you do.
Yeah. So we everything's patient specific. You know,
Okay.
if the patient has a little pain, we're going to take care of them. That's not going to. We're going to take care of them with any discomfort they may have. But you know, a lot of my patients go to work the next day. I tell them at least take one day off. You know, just take one day. You're fine. Take one day off. But yeah, a lot of them go to work the next day.
Nice. You brought photos.
Oh yeah.
What are we looking at?
Yeah. So this patient, this first picture I have, this patient came into my office, and you can kind of tell. I was telling him, hey, smile for me, and this patient couldn't smile because he just didn't know how.
Okay.
And so this patient was suffering with bad breath, sensitive teeth. He had bacterial infection in his gums. So he has gum disease and wiggling teeth.
All right.
And so he was heading for a denture. And so, like I said, I'm very, I'm artistically focused. And so when I first saw this picture, I'm like, man, I know what I can do for you. And I was excited for the results.
So his option would have been a what?
It would have been a denture.
Okay.
Would have been a floppy denture.
So no way.
No way.
Okay.
And so he came into my office and 2 visits. Second visit was surgery, and the day of surgery, he left with teeth that don't come in and out. And so he left with top and bottom.
It looks good.
He left with top and bottom teeth attached to the brand new smile, teeth attached with the dental implants. Randy, look at the before and after photo.
Okay.
How does the eyes look?
Well, they're different. They're open in the after.
How does the smile look?
He looks better. He looks a little younger, actually.
Does he look a little smarter too?
He does, yeah. You say it makes people look more sophisticated and educated.
Okay.
I mean, teeth do that, right?
Yes.
Okay.
And so before, this patient couldn't eat ice cream with his kids.
What do you mean?
Ice cream, and he had tooth sensitivity. And so whenever he drank or ate something cold, he just would have extreme pain. He wasn't even confident eating ice cream, taking his kids to getting ice cream. And so now, like I said, all my patients have a connection to me, and they can directly reach me. So I called him recently, and he was telling me how he's a truck driver. He was delivering something, and every time he's out and about, he gets compliments on his teeth.
Is that right?
I mean, he's smiling from ear to ear.
How soon can they eat, by the way?
Right after the procedure.
Just soft at the beginning,
soft,
and then you go to whatever.
Yeah, soft in the beginning, and he can kind of progress. Randy, I have this next patient I wanted to show you.
Okay.
This patient comes in. His missing teeth on the right side. Kind of when he smiles, he kind of hides that right side. And so he has 7 kids. He works hard. He comes in. He's like, Doc, I'm ready to invest in myself and finally get the smile of my dreams.
So is he missing like back? It seems like he's missing his back teeth too.
He's missing his front, his back teeth, and he only has about 3 or 4 teeth on top and bottom left.
Okay. How long does somebody usually go this way before they do something about it? Like, could be years?
It could be years. And he came in. He worked hard his whole life.
Okay.
He's worked hard for his kids. He's worked hard, and I've had patients like this all the time. They're raising their grandkids or raising their kids, and they're like, I'm ready to finally invest in myself.
Okay.
And so he came in, and we gave him top and bottom fixed teeth on implants that don't come in and out.
Okay.
And he could not be happy.
That looks good, by the way.
Yeah. Look at his eyes. I mean, look at his smile, Randy. He's able to smile now.
You say their smiles get better over time. When you say that, what do you mean?
Well, when you first get a new set of teeth, it's odd. They look good. You're not used to smiling because you weren't used to smiling before. So every other visit, I see him. His smile gets bigger.
As he gets compliments.
He gets more confident. He gets more compliments. And the change, he's like I told you. He should have done it sooner. He wish he would have done it sooner.
What's it like when they see? And I know they're coming out of sedation, things like that. But what's it like when they see their teeth for the first time?
Oh, I mean, I get
like even for the family members.
Oh, I've had patients cry. I've had patients they're lost for words because they knew what they could look like. They knew how they wanted to look like, but actually having that in their mouth is, I mean, it gets me excited. I mean, I'm so excited.
And you say there's a lot of advertising for dental implants in your area, and you say you're less. In fact, you told me in the green room about 24% less than the going rate for getting an upper or lower set of teeth
Exactly.
supported by implants.
Yeah. So a lot in
As of today's date.
Oh yeah, and in other offices, there's two providers that do this procedure. One provider does the surgery and one provider does the teeth.
Okay.
I do both, and I do my own IV sedation in my office, and so a lot of other providers have someone else do the sedations. I mean, it's just and they send
It adds
out,
up because it's multiple people.
They have different labs,
Okay.
different things, and no, I do everything in house. So that's why we can provide it efficiently and at a 24% discount.
Okay, good.
Than
Good.
the other locations.
Good. You have more photos. What else are we looking
yeah.
at? And I'll rush you a little bit because we're short on time. It's good stuff.
Yeah. So this next patient came to my office. He, like you said, he actually he fosters kids, and so he came to my office and he fosters kids, and he worked really hard. And he's just like, I'm ready to, like, same with the other patients. They're ready to take care of themselves, because no one who else is going to take care of you other than yourself. And so he's taking care of himself. So he came in, he's got cavities on all his teeth, bleeding gums.
So he couldn't eat very well.
He couldn't eat very well, and he was missing his back teeth. And he loves salad. This patient absolutely loves salad. He came in a couple of times because he was eating salad in his temporary set of teeth. I'm like, man, let's hold off on the salad until we get your nice new porcelain zirconia teeth at the end. And so we did for him. Same thing we did.
So he would have ended up in a denture. I mean, all these photos here are people that one of their options was a denture.
Yeah, these are patients.
He looks like a different guy in the after.
Oh, yeah.
Or as far as a little bit of confidence, charisma.
Yeah, no,
I'm not trying to side with you, by the way.
Oh,
But
no.
it does look good.
Oh, no. These are patients that they've heard from other providers that they're heading towards a denture, or they felt like they're heading towards a denture. So now that he has his new teeth, he can eat at all the best Hoover locations. You got your Saw's Barbecue, your Jim and Nick's. You can eat that.
So they're not restricted.
Oh, no.
Eating off the bone.
Oh, eat off the bone. They can eat whatever they want.
And they do.
He loves salad. I can't tell you.
So he's a salad guy
He's a
now.
salad guy, nut guy, and so... And can you imagine, trying to eat salad with a denture that's not locked into place? You can't eat the food
That seems like an easy one to eat if you have a denture, but no. The little things are tough.
Yeah, little things because you have to grind them down.
I know you brought more photos,
well,
so I'm going to rush you a little bit.
Okay, let's
We've got
go
about
through
2 minutes.
Let's go through these real quick. So this next patient, young patient, same thing. She was just born with a bad set of teeth. She went through root canals, crowns, and
she's young.
Yeah,
She would have been in a denture as well.
She would have been a denture as well.
So what did you do for her?
So for her, we did the brand new smile, fixated on dental implants, a top and bottom, fixed teeth.
Looks good.
So when I get a young patient like this, I get excited because I know how this is going to impact her trajectory. Her confidence.
Like where she ends up in life.
Oh yeah, where her confidence and her ability to work and socialize, everything's going to be different.
Okay.
For 20, 30, 40 years, from this moment.
You say patients tell you that they feel judged, like they're poor, you said, or they're unclean. Elaborate on that.
Yeah, I mean, I've had a little story we can quickly talk about. I had a patient who was missing teeth on the top, and he said he didn't get a promotion in his job because of that missing tooth. Well, I don't know if that was the case, but I did this procedure on him where we gave him the fixed teeth attached to implants on the top. And he got a promotion a month later. I'm not saying
maybe his attitude improved.
His attitude improved, and he had the confidence to ask for that promotion. And he got a promotion a month after he got his new teeth.
Very nice. Time for one more.
Okay,
I'll rush you. I'm really going to rush you.
I got last one
seconds.
over here. So this patient comes in, upper lower dentures, and same visit we were able to give him fixed teeth that don't come in and out, fixed teeth attached to dental implants, full arch of teeth that don't come in and out. And he
looks good.
He wishes he could have done it sooner. I mean, he looks like he's 20 years younger, wouldn't you say, Randy?
I'd say he looks a lot younger for sure.
Yeah.
What do they like more, the way it looks or what they could eat? Or is it a combination of both?
Well, it's a combination of both. Some patients come in just for the looks, and some patients come in for the function, for the ability to function, to eat with food.
Okay.
Funny story, I had a patient had a mustache all the way down to his chin
Okay.
before the procedure. And after the procedure, after we delivered his final teeth, no mustache. I'm like, where did your mustache go? That's how I recognize you. and he came in just so he can eat better, and he left with his wife can't even recognize him anymore because he's smiling all the time.
Now he's smiling all over town. Now, is this a big problem? I mean, are there that many people in Alabama or in Hoover or surrounding areas
Oh yeah.
that are headed for dentures or could benefit from this?
Oh yeah. So in Alabama, we're good at two things. Okay. Number one is football. We're really good at football.
Okay.
And number two is having missing teeth. And so this is a huge need.
And it's kind of an easy fix
Alabama.
for these patients.
Oh yeah.
In a way.
Easy fix.
Technically demanding for you, but easy to do.
Oh no, this is why. I mean, I grew up in Alabama, and this is exactly where I want to be and where I want to do this procedure.
Final question I have, because this comes up a lot about cost, because Medicare doesn't cover this really, Medicaid doesn't cover this, even the best dental insurance doesn't cover this, and you say people are financing.
Oh yeah, people finance this. People finance it. Up to 6 years. So we can bring this down to an affordable monthly payment for patients.
Okay.
And so
you have to have okay credit though.
You have to have okay credit, but we do free consultations. So I just tell patients, just come by, come see us. We can go over all that with you in the office. You don't have there's no obligation. You can get a second or third opinion, because I know we're the best priced in Alabama.
Good for you.
And I know we provide the best service in Alabama, because
that's your goal.
That's my goal. So
Okay.
I've worked at these these corporate offices, and my goal, and I'm the owner. So when you come to my office, you come see me. You're not going to see someone else. And so my goal is to provide the best service at an affordable price. That's my goal, and I'm building my office to do that.
Okay, you said people come on and always talk about their team or their staff, and this is one of the things you wanted to make sure that was mentioned today.
Oh,
that
yeah.
You really have a good team.
I have the best staff.
Why is that so important?
I mean,
I know it seems obvious, but
I mean, you
like they also have to be trained in implant dentistry.
No, yeah, of course. So, and I've been to these offices where you walk in, you got the sliding glass door, you can barely see in there who's in there. No, you come in my office, you get a warm welcome from my front desk and my office manager. I have a wonderful assistant. I mean, we have an amazing team that's going to take care of you, and we have a wonderful team.
Good for you. Final message. Somebody wants it. We're out of time. The two groups you talked about at the beginning of the program, they currently have teeth, but they're bad, and they've been told they need a denture.
Yes.
Or they were told they don't have enough bone to do this. The second group, the denture wearers. They've heard you, but they're still skeptical. What do you say to them?
I just say, just come by. We offer free consultations. I mean, it's no obligation. Just come by and just meet us, and get to know us, and we'll come up with a customized plan for you specifically.
And you'll discuss financing as well.
We'll discuss financing.
You have to have okay credit to get this.
Oh, yeah.
To get this. Okay.
Okay credit, but we'll take care of you. Just come by. And let's
know
talk
your
about your
options.
options. Exactly.
Okay, good. Now, do you prefer they go to the website, make their appointment there, or just contact your office, make an appointment?
No, yeah. So we're really easy. So either go to our website. We have online booking on our website,
Okay.
or you can call the office, whichever you prefer.
And they get to see you on the consult?
Oh, that's me. Exactly.
All right. Well, thank you for coming on the show. Good stuff.
Thanks, Randy.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.